Hello everyone, I am Dr. Ramya, consultant obstetrician and gynecologist and laparoscopic surgeon at Nano Hospitals, Pune. Today, let's discuss about an important topic, that is the signs of labor. So as you enter the third trimester, that is after 28 weeks, most of you have doubts in your mind like, Doctor, how will I know once I go into labor? What are the signs? How will I know whether it's a delivery pain? So, first thing I would like to say is stay calm because you will definitely know when it comes because the experience is unique and as the symptoms starts, you will definitely know that you entered into labor. So, most commonly after 37 weeks of pregnancy, many women start getting the signs of labor, but sometimes it can happen early too. Then we term it as a preterm labor. So, what are the important signs? There are three important signs. So the first is the contractions. So how do you know that this is a labor contraction? How do you differentiate it between the normal pains that occur in pregnancy from labor pains? So first thing, how does the labor contraction start? So you will start feeling some kind of tightness in the abdomen and it keeps coming regularly at frequent intervals. So your abdomen becomes tight for few seconds and then it relaxes. It is something similar to the menstrual cramps, but it is more severe and it starts coming very regularly at frequent intervals, and also the intensity of the pain increases. It doesn't subside on taking rest or something like that. So that is the first sign, that is the onset of the labor pain. The second sign of labor could be water breakage. So the baby in the womb, it is surrounded by a sac called the amniotic sac, and this sac is filled with a fluid called the amniotic fluid. This is a very important thing because the baby inside the amniotic sac is safe. It provides nourishment to the baby, as well as this amniotic sac acts like a shock absorber and it prevents the baby from the external impacts. So as the labor sets in, you can just imagine like a balloon which is filled with water and the baby is inside that balloon. So what happens once the membrane breaks, the water inside that balloon leaks. So similarly, once the membrane ruptures, there may be leakage of the amniotic fluid, and that we term it as leaking PV, or in layman terms it is termed as the water breakage. So this sometimes may happen before the onset of labor pains. You may not have pain, but first you may have water breakage, or sometimes it may happen somewhere in between, like once you start getting the labor pains, in between somewhere you may rupture the membranes. So that is the second sign of pregnancy, that is the water breakage. The third sign of pregnancy is bleeding per vagina. So frank bleeding usually is more alarming. What usually happens is a mixed discharge, which is the white discharge which is mixed with some pinkish kind of discharge. This happens because of the changes that happen in the cervix. So once you enter into the labor, the cervix slowly starts dilating. There are some changes that happens in the cervix, and there will be release of certain chemicals which causes rupture of the blood vessels which are there in the cervix, and this results in something called bleeding or white discharge which is mixed with bleeding, which we call it as show. So that is the third sign of labor. Any frank bleeding is more alarming and you have to contact your doctor immediately, and that is usually because of certain abnormalities associated with the placenta. Now one more sign I want to tell you all is the monitoring of the fetal movement, the baby movements. So most of your doctors tell you to monitor the fetal kick count. So how your baby moves in a day, please observe that. If you see any drastic decrease in the movement of the baby, generally we tell to monitor the baby movements morning, afternoon and evening after your each meal. So 1 hour after each meal, you're supposed to monitor the movement of the baby. In that 1 hour, if you're getting around 4 to 5 movements, overall in a day, if the kick counts crosses 10 to 12, then usually that is sufficient. But if you notice any drastic decrease in the movement of the baby, or if it is less than 10 movements, then also you're supposed to report to the doctor immediately. So these are the 4 important signs you need to monitor once you're in the third trimester. First is the onset of the labor pains. Second is any leakage. So that could be a gush of leakage or a slow leakage of amniotic fluid. Third is the bleeding or cervical mucus discharge, which is mixed with blood. And fourth is the fetal movement count. So these are the 4 important signs you need to monitor, and any of these symptoms, if it appears, you need to report to the doctor immediately. So that indicates you are going into labor. So these are the 4 signs of labor. Thank you.